today as we celebrate the Post-Disaster Mental Health Response Act and the work of confronting and treating trauma in the Massachusetts 7th and across our country. First, I want to acknowledge and thank the woman seated to my left who made this possible, Manya Chilinsky, a survivor of the Boston Marathon attack, who reached out to our office and first brought the issue to our attention. Yet another example of the power of a single voice. I just want to reiterate that because we are here today celebrating a piece of legislation that has been signed into law because she sent an email. And then since that email was sent, we began a relationship and have been in conversation and in work for several years to make this day possible. I want to also acknowledge my partners in government who join us here today, Senator Miranda, Representative Worrell, Councilor Mejia, and other local leaders and officials. Of course, our partners in healthcare, thank you, Charlie Murphy, and the entire team here at Harbor Street for welcoming us and for what you do each and every day in the interest of public health. You are also good neighbors in every way and involved in so many things, so we thank you for daily standing in the gap and meeting the needs of community. And of course, we're going to get into a roundtable, but I do want to offer some very brief remarks because it's most important to me that we have a free-flowing conversation about the impact of the Post-Disaster Mental Health Response Act, as well as the work that we have before us as policymakers to build healthy communities, making sure everyone impacted by trauma has a pathway to healing. As many of you know, since my tenure on the Boston City Council, it has really been my heart's work to prevent trauma, to mitigate trauma, and to treat and to heal from trauma in all forms, and to do the work of advancing survivors' justice, whether you are a survivor of sexual assault, of community-based violence, of gun violence, or of domestic terrorism, or a natural disaster, which is how we find ourselves here today. Again, it is an example of the power of a single voice, the power of our constituents, and also what I call cooperative governing, solutions that are community-driven and government-endorsed. And as I so often say, keeping those closest to the pain, closest to the power, driving and informing the policy solutions. When disaster strikes, whether it be a natural disaster or mass violence, survivors are often left grappling with lasting trauma, which has devastating impacts on their mental health. But too often, critical mental health services offered by FEMA to cope with these tragedies are inaccessible. Those who experience trauma from tragedies like the Boston Marathon bombings know what it's like to walk away from a tragedy with invisible wounds and to suffer in silence. The Post-Disaster Mental Health Response Act aims to change that by expanding mental health and trauma resources to survivors of even more disasters. And again, I'm so happy to have seen this signed into law by President Biden. With the passing of the Post-Disaster Mental Health Response Act, FEMA crisis counseling assistance will be available to more survivors regardless of a tragedy's designation. We'll talk a little bit more about that later. Trauma is nonlinear and indiscriminatory, and our federal response should meet every impacted individual exactly where they are. This measure will confront what I deem to be the next pandemic, and that is trauma, and the impact of mental health on our society for people of all ages. We spent years, since that first email from Manya, working in partnership with our colleagues like Congresswoman Judy Titus, Senator Dick Durbin, and others, and many of you here today, to get this across the finish line. Again, I look forward to a day where people do not have to relive their trauma in order to compel action from their government. But I am grateful each and every time that someone like Manya steps up to do it. Again, this is another testament to the power of cooperative governing, an important step towards addressing the cycles of trauma that have trapped our neighbors and our loved ones on a difficult road to recovery. As someone who has made it my life's work to advance policy that address trauma and to promote healing. I'm so proud to host this discussion and to celebrate this momentous occasion. And I'm especially grateful to Manya and other survivors who have called for action on this front. It is not easy to relive your trauma, to share your story repeatedly in the aim of meaningful policy change. Your experiences inform this legislation every step of the way, and we would not be here. I'm sorry, I'm a little emotional. And we would not be here today if it weren't for your advocacy. And in that vein, I would also like to ask our esteemed participants to introduce themselves and share any opening remarks before we jump into a more formal roundtable discussion. And we will we'll start actually with to the left of me and go around the table. So.
Hi everyone, I'm Manya Chilinsky, and can I just say that I never imagined that first time I spoke with one of the Congresswoman staffers on the phone that it would turn into something like this. That's what I wanted. I just didn't know if it was possible. When I first spoke with your team, Congresswoman, I was just coming from a place where I felt invisible. I felt that having mental health wounds didn't count, and people weren't thinking about it in the big picture of the response. And I called your office asking for help, and I didn't even know what I was asking for. But through our conversations and the work that you and your amazing team have done, we came to this place. So I want to say thank you to you and your team for this work as well. I mean, we wouldn't be here without me. We definitely wouldn't be here without you.
Well,
so thank you.
We can give it up to my team.
Yes. Give it up to the team.
Thank you so much, Manya. Senator?
I don't have a microphone. Can we share that one? I just don't know.
Yes.
Gotta flip it up.
I haven't had my coffee this morning. Thank you. After a devastating, traumatizing, and challenging 2-week span in the 2nd Suffolk district, where we saw the loss of a 13-year-old boy in Mattapan and a 21-year-old woman in Jamaica Plain, I wrote some remarks, and normally I speak from the heart, but I'm going to read them because I think we're all sitting in a space that we all know who are survivors, and our communities are full of survivors, that often when we talk about traumatic events, they stay with us. And so I just want to start there by calling that into the room. I want to say good afternoon to everyone. I'm State Senator Liz Miranda. I want to say hello to my colleagues and really thank the Congresswoman and Harvard Street Health Center and your staff for inviting me here today. We know that this roundtable discussion is creating a space here to discuss the intricacies of a disaster in correlation to the impacts on someone's personal mental health. The passing of the Post-Disaster Mental Health Response Act will have a monumental impact, and we already are hearing about the impact today, for communities much like those in our district who need additional support to ensure that families and communities have immediate and life-saving resources in times of crisis. And although it's very simple, it's very monumental. It would amend FEMA's existing crisis counseling assistance and training program so that it applies to emergency declarations, that even if you're not a major disaster, you can still receive the mental health support for the impacted community. That's really important because just because something isn't designated as a major disaster doesn't mean it isn't major in a community. It has long-lasting impact. I'm a lifelong Bostonian. When the marathon bombing happened, even though it happened in the Back Bay, it was felt all over Massachusetts, and particularly in communities that had to go through that. And it impacted us all. We felt the pain of the families who had to say goodbye to loved ones, see their loved ones physically and emotionally harmed, and some folks were left behind. How we respond to crisis and trauma directly influences a person's ability to recover, and the Congresswoman mentioned to heal and meaningfully continue a healthy life. And that's what we want for our people in our communities, that they live a healthy life. And so I want to thank you all for being here this morning. We'll talk more, but I just want to call into the room that passing anything into law is a very big deal. So I just want to thank you, Manya, and thank the Congresswoman and your team for making this a reality here, not only for the 2nd Suffolk and the 7th, but also for the entire state of Massachusetts.
Can't believe I'm supposed to follow that. Okay.
Mine were written.
Yes. All right, I didn't have extra help. I did, however, have nagging from a 19-year-old who's almost as good. My name's Dr. Paige Shaw, and I am the Director of Behavioral Health at Harvard Street. I want to thank you for coming in and sharing all of this tremendous progress with us today and being able to bring it right to our community. And I also want to thank Charlie for offering me the opportunity to hold forth when he knows full well that I should not be allowed anywhere near my phone.
You're in good company.
When I was thinking about what we needed to say, I had a lot of folks from here come and speak to me, and they said, "Are you going to talk about our patients? Are you going to talk about everything they need? Because there's so much that they need." And one of the things that you said just now that was really just so striking was this notion of trauma being the next, frontier for everyone to be addressing as a crisis. And, the folks that we work, the wonderful people who work here every day are wading through that as not a baseline, but somewhere way up over people's heads already. We're talking about multiply stressed folks with multiple generations of trauma. And so the crisis isn't coming. For us, the crisis is alive. And that wasn't even what I was thinking about when I was thinking about the things that I wanted to represent for Harvard Street, which is that I work with a wonderful, dedicated group of behavioral health clinicians. And we also have a robust training program. And these are people who really get the mission and who really understand what it is to deliver behavioral health integrated with medical health as part of improving the lives of the folks in our neighborhood and in our community. And so what I want to represent, because it's probably not going to get talked about, is the notion that our folks are also suffering.
That's right.
We've been carrying this load equally since the beginning of the pandemic, which was a tremendous crisis on top of other crises that afflict our community. And our people have borne up with an unbelievable amount of grace. But there's a lot of folks, particularly in my field, who left work in the community to go sit and do telehealth where it was quieter and more peaceful and easier than fighting with the insurance companies. So we have a laundry list of things that we would love to attack and think about sort of as we weave through how these things get funded. And I want to speak for one more group of people, and that is the trainees, the students, the pipeline that's coming up through the ranks, getting the training, spending hundreds of thousands of dollars, and incurring all kinds of debt so that they can serve in communities like this one. And we need to also think about them and make sure that that support and funding and thought and compassion also goes toward these wonderful individuals who are willing to dedicate their careers to building health in all areas of Boston and Massachusetts. And see, I can't stop.
Thank you, Dr. Shaw. Thank you.
My name is Martin McDonald. I'm a survivor of the Boston Marathon bombing. And I suffered a traumatic brain injury from the bombing. And that was challenging enough, but in addition, I had some pretty significant PTSD as well. And that's something I really was not prepared for at all. And it kind of comes all at once. So I really appreciate all this. And I just want to add one thing. At one point, I did a support group at Spalding Rehabilitation Center, and it was both survivors and providers. And it was really eye-opening to me how much the burden the providers carry as well. So I really appreciate this and the support, and Manya and Congresswoman Pressley. And so thank you for this important work.
Thank you. Thank you, Martin.
Thank you. Hi everyone, my name is Samantha Palladini. I am the coordinator for the Climate Resilience Hub program with communities responding to extreme weather, also called CREW. We are a young community in Cambridge looking to create equitable climate resilience by providing resources, information involving climate action. I want to thank you so much and I'm so honored to be a part of this conversation today. And I'd like to bring the perspective of the natural disasters and interconnection between extreme weather and these events and the people who are affected by them directly before and also lasting after, involving mental health. Thank you.
Thank you.
My name is Lynn Julie Fishy, and I too suffered a brain injury, so I wrote stuff down. Your life becomes full of post-it notes and everything like that. The Post-Disaster Mental Health Response Act validates and helps meet the immediate emotional needs.
I'm sorry, Lynn, I'm so sorry. We want to be
Closer?
yes.
Thank you.
We want to make sure we're hearing everything because we've so thoughtfully prepared it. Yeah.
The Post-Disaster Mental Health Response Act validates and helps meet the immediate emotional needs of survivors of all types of disasters, equally and inclusively, by focusing on the one thing that unites us, our trauma. After I survived the Boston Marathon bombing with permanent brain injury, permanent hearing loss, permanent and severe neck and back and shoulder injuries, and what was now complex PTSD, I was unable to access mental health therapy promptly. I was also unable to access group therapy until 7 months later. And I'm grateful for the group therapy, please don't misunderstand, but I needed it on day 1. I needed therapy promptly and not 7 months later. And this is one of the reasons that my PTSD became complex and now chronic. This was only because our terrorist attack in my backyard, the finish line is pretty much in my backyard, of Boston's Back Bay, was labeled an emergency declaration by the president and not a major disaster. And Ayanna Pressley's Post-Disaster Mental Health Response Act closed that loophole by providing 9 months of mental health therapy after every kind of disaster, not just one or the other. So, thank you.
Good afternoon. My name is Maria Arredondo. Many of you might not know who I am, but I am too also a marathon bombing survivor. Most people know who my husband is. My husband is Carlos Arredondo, for those of you who know the man in the cowboy hat who assisted Jeff Bowman, who lost both his legs immediately after the bombings. I'm speaking on behalf of both of us. Prior to the Boston Marathon bombing that day, which was an activity that we included in our family for about 12 years with both of our sons, my stepsons and his sons, Alexander and Brian. My husband and I had experienced both as children, emotional and sexual abuse. We were both raised in poverty. However, I will say to about my husband that he was raised in Costa Rica, where poverty consisted of no shoes until the age of 2nd grade, when he finally got a pair of shoes that ripped off, and they smelled a lot, and that's what he had to wear at school. My husband left school at the end of the 7th grade because there is not enough food in the house to help his family eat, because he had two other siblings and his mom. Fast forward, Carlos and his former wife had 2 wonderful children, Alexander, the oldest, who joined the United States Marine Corps and was killed in action at the age of 20 in 2004. My husband reacted in such a way that he ended up setting himself on fire the same day that this occurred. My husband and I also raised his younger son, Brian Arredondo, who only 13 months earlier had taken his life here in Massachusetts. Currently, we both live in a state of poverty. This may be surprising to those people who may have followed the story and thought that the media was paying us money for giving our interviews. Let me explain to you who the first two visitors were to our house the day after the bombing. The first were the Boston Police Department Investigation Unit. They thought Carlos had something to do with the bombing. The second visitors were the FBI, who also thought Carlos had something to do with the bombing. Carlos and I closed the door, looked at each other, and said, they're trying to pin this on you. We have to change the story. At that time, there was a line of many media outlets, the cameras, the different reporters, going down our sidewalk and around the block. What we decided to do was explain why we were there, what Carlos did, and how important it was for us to speak to Spanish-speaking media, because that is both of our native tongues. I need to put this in perspective, because also as we talked to the media, no one reached out to us who had anything to do regarding helping survivors, because not only was Carlos helpful that day, but he was up close, saw everything, saw Crystal Campbell, saw many people who had lost limbs, and helped Jeff, who had lost both of his lower limbs. To this day, he still has nightmares. A few months later, we found out through Tia Martin, who works for the city of Boston, about the support group at the Spalding. We attended. We were asked to leave. You heard that right? We were asked to leave because apparently there were some people in the room who believed that we were there for our own benefit and to leak stories, which could be farther from the truth. Because we are both parents of the fallen, we reached out to MGH Home Base, which provided us, finally, some assistance in trying to process this and the many other traumas, as well as the death of our son due to combat. So I want to tell you a little bit about me. I was working down the street from here at the Upham's Corner Health Center in Dorchester, where I worked for 13 years in the community, primarily with Spanish speakers, but I also knew at that time a bit of Cape Verdean. Okay? I was at that time the supervisor at the HIV, for some time the supervisor of the HIV/AIDS Services Department. At that point, I was asked by my executive director a few weeks earlier to work with Harvard University on a research project. 2 days after the bombing, I met with young people throughout our community for a focus group. My questions went to the side. They talked about the bombing and how it impacted them. And I totally agree with Senator Liz Moran that the people of color, people who low income, people who do not have English as a first language were forgotten. I also want you to realize that there were 3 Latino families, myself and 2 others, who were bombing survivors. Okay? we did not find out information on how to get services. So at that, I'm going to let you know that Carlos and I experienced some physical injuries. We lost our hearing significantly. We both wear hearing aids. I don't have them on today because one of them is broken. And they are not covered by insurance. So we both have profound hearing loss. My husband, much more. So I will pass it along to not only my city councilor, but also one of my good friends and a person who also believes that policy is her love language. Thank you very much for listening to me.
Thank you. So I just want to say before I even get started, I just wanted to thank everyone who has shared their story and their vulnerability and helped us understand the why we are all here, because we're all carrying something. And so I think it's grounding that in that why that is going to make the work that we're about to embark on so incredibly powerful, because it's stories like we've heard so far that remind us of why we exist. And policy is a language that I'm learning through my mentor here, Congresswoman Ayanna Pressley. You know, you introduced the work of trauma to parents that I had been working with, and we didn't even know we were traumatized. We were carrying things into spaces and places, not knowing how we were showing up and not knowing how to name it. And it was through your leadership that we recognized that we too were traumatized. And through that work, we realized that we needed to do something in our schools so our schools could receive our kids who are carrying trauma in their backpacks in ways that embrace them. So it's through your work that I am here, and I am so grateful for you and everything that you have done, that you continue to do on the federal level to hold us down. So thank you. And thank you for your leadership, okay, and all of the Boston Marathon survivors who we're here to not only uplift and support, but recognize the important role that we play in making sure that we move this work. Just quickly, I am an inspired speaker. I am trying to model my colleagues' behavior here. I don't have prepared remarks, but I have a few bullet points that I just want to uplift. I lived in New York during 9/11, and I remember that day. And I remember the hostility that was placed on immigrants and people from diverse experiences, if you will. And that's trauma that has never been treated. And that was a national disaster. But the residual impact of the hostility that followed has never been addressed. And I think it's important for us to uplift that, because then, having grown up here in Boston and being here during the Boston Marathon, I saw that here yet again. And Dorchester, Roxbury, and Mattapan, when the pursuit was happening, we were all traumatized by that chase and figuring out what was going to happen. So there's some work to do there in neighborhoods that are the casualties of the national disasters that we need to pay attention to. And then, you know, I just want to uplift as we continue to move through this conversation is that COVID is in many ways part of that traumatic experience that we're going to have to lean into, because we have expected people to go back to work and leave their full selves behind. And that includes employers, you know, employees, families. We just have to really look at COVID as a natural disaster and how we're going to lean into that conversation. So I am honored to be here and to listen and learn, and more importantly, to understand and to share my commitment to the work of trauma. Having worked through my own, I think that Congresswoman Ayanna Pressley says it best, is that those who are closest to the pain need to be closest to the power. working in deep collaboration with the people who are living the realities to inform policy. And I am here for that. And I think that, you know, as an Afro-Latina and as a Dominican woman who migrated to this country, I really do believe that as we continue to have this conversation, we need to recognize that immigrants and our trauma needs to be centered in how we're going to respond, because we don't know how to. And so more resources need to be poured into that work so that we can feel okay saying it's okay not to be okay. And that we don't always have to be superwoman. So I want to just uplift that and carry that into this space as we continue to have this conversation. Thank you.
Thank you, Councilor. Thank you, Councilor Leah. Thank you.
Good afternoon, folks. My name is Charlie Murphy. I'm the president and CEO here at Harvard Street. Thank you, Congresswoman, for joining us and asking us to participate in this. It was great. I want to thank the Harvard Street staff who did a fabulous job getting it done. Your staff was excellent as well. Sophia and Eric made the call, and my team kind of jumped and pulled it together. Eddie from Uplands was supposed to be here up until about 5 minutes ago, so he sent his regrets. But it's meaningful in a real way. So when you call and ask a question, as we were talking about earlier, the answer is yes. What is the question? And that's how I responded on Thursday to this request, because it does truly mean a lot. And I just want to make, I guess, one editorial comment before I pass it along. And it dawned on me as we started with the Congresswoman and moving on and listening to the different stories. Too often, I would suggest, elected officials, and be transparent, I was one for many years ago, but too often elected officials are just vilified, right? Nobody likes elected officials. Everybody likes their elected official, but in general, nobody likes them, whether it's state rep, Chris Rowe, thank you for being here, Liz, federal, local, whatever the case may be. But this, I'm so happy to be here, because this is exhibit A of how it works. A constituent makes a phone call, the elected official listens, staff digs in, and the president of the United States signs the bill.
That's right.
And this legislation is truly just transformational will be thousands of lives as we go on. But just the exercise, and I just hope people recognize that and acknowledge that, because it's not always the case, unfortunately. And you know that, and you know that. Anybody elected knows that, and that comes with the territory. You take your lumps and you move forward, but you still work and you still get the job done. So this is just a fabulous result. Thank you, just for the great work. And again, anything you need, I
Thank
respect
you.
you.
Thank you so much. Yeah. Well, a lot was already covered here, but there's still so much more that I want us to try to confront, and my team here will keep us honest on time, because I know there's a press component, which I hope that as long as you can stay, you will. And, President Murphy, you were saying that you're not usually, this isn't a typical day, and there aren't cameras here every day, but I wish there were. Because the work that happens here is so essential. Every single person here is an essential worker, and again, has not been exempt from trauma or hardship, period, but especially during these consequential, most recent years. And so we applaud you and we thank you, and I will say what I always say about our health centers, and that I'm so proud to be the member of Congress that represents the most health centers in the country. 15 are in the Massachusetts 7th. 1 in 3 of my constituents receive their care from a CHC. And you do serve our most vulnerable, and those representing often multiple marginalized identities, layered trauma. You are an incredible employer to the community, again, good neighbors, and our health centers are overutilized and under-resourced. And I will always fight for them. So again, thank you for hosting us today. I did want to throw out a couple of questions for the table. The first is, Manya and other survivors of the marathon bombing, and then also Samantha, if you would speak to, what is the current process in terms of how people go about accessing services in the wake of any of these tragic circumstances, and how will this improve that access?
So my experience in the bombing was there wasn't a clear path for me. I didn't know where to turn for help. I ended up going to a meeting. That was to prepare for the privately funded victim compensation fund and to communicate with the community what that was going to look like. And they made it very clear in that meeting that people with mental health wounds were not going to be addressed. And I left the meeting because I felt like it was just one more place I was looking for help, and I was looking for information, and there either was no information or I was being told that was not something I could participate in. I managed to find my way, thanks to the Red Cross, to the Massachusetts Office of Victim Assistance, which I never imagined we had such an office. I never would have looked there, because what happened to us was a crime. They were gathering services, and that's the way that I connected with the community and ended up meeting these fabulous survivors who I'm grateful to call my friends. And, you know, I think you guys can share your individual stories, but it just felt to me like I kept knocking on doors and kept saying, can you help me? This thing happened to me, can you help me? And at various places being turned away. I spent a lot of time looking at the media, like, what are they saying? And they weren't talking about the mental health wounds. So it felt like if I was going to get help, I had to figure it out myself. And I'm grateful that I did, and I'm grateful that I have health insurance and was able to get some assistance through my doctor's office as well. But it very much felt like I was, what's that image of a duck, right? Like on the water, on the top of the water I looked calm, but underneath I was like, where do I go? What do I do? How can I get some help? And I'm grateful that I was able to find some of the right places, but I know many people that I met later who never found some of the resources that I found.
So, Moni, thank you for, and this is something I said in my opening, and I wanted to just reiterate, invisible wounds. Because the thing about trauma is that it manifests differently. It presents differently for every person. There's that primary trauma, and then there's secondary trauma. And then often in our response, we tend to create a hierarchy of hurt. And that is where you will see those inequities and that chasm really widen. Also on the point that you just offered about the looking okay at the top of the water, I want to say this is in some ways the challenge with the frame of something like Boston Strong, which many derived great inspiration from and were emboldened to persevere. However, it in some ways infers that everyone is okay because folks are just continuing to move and staying afloat and continue to swim. But there are these invisible wounds. So I hope that will be a takeaway for people, that there is no hierarchy of hurt. We have to find a way to meet everybody where they are, and that there are physical wounds, there are invisible wounds, and everyone is deserving of a pathway to healing and access to mental and behavioral health services. Whether you're talking about domestic terrorism, a natural disaster, community-based violence, sexual assault, whatever it is, whatever you're a survivor of as the result of some traumatic, disruptive life happening, everyone is deserving of healing. Okay, would love to hear from some other survivors, yes. About what your process was.
Right. I just wanted to chime in on what you were, follow up on what you were saying, that even with things like the One Fund I was told by the director, Lori Van Dam, I volunteered for the board of the Resiliency Center along with Manya and Mel, and I volunteered for the board of the One Fund, and was told that we are not acknowledging internal injuries, so-called invisible injuries like permanent brain injury and permanent hearing loss, because the quote was, "We know what the donors meant with that money, and it wasn't for that." And I'm not trying to be negative. I'm not trying to throw people under the table. I'm trying to reiterate what Congresswoman Pressley just said, that there should not be a hierarchy of who needs help more than who doesn't need help. Even when I went to the emergency room, and there's no need to name names because it doesn't matter, USA emergency room anywhere, I sat there for 7 or 8 hours, and all they offered me was a priest. And that couldn't help me at that time. I needed medical help. And I was sent home, and all that was written on my discharge papers was the word anxiety. That's it. And I just survived a terrorist bombing. I am now diagnosed with permanent brain injury and permanent hearing loss and neck and back and shoulder injuries and complex PTSD and all this other stuff. But that took years to get those diagnoses. And even with volunteering with the Resiliency Center, we tried so hard to give so much to so many, and we still weren't getting access to the services that we need. I found out about the support group on Google, which isn't how we should be left to find out where support is. And even through finding out the support group on Google, I was so petrified by that point. You have to remember, living in the neighborhood where I do, there were armed guards in front of every major building, including mine, so I had to excuse myself by someone with an assault rifle every day. The Copley Square was just a mass, a sea of press and memorials. To get to my EMDR therapy, I had to walk through a tour group of people who put the site on a paid promotional tour, and they bus people in every day. They would bus loads of people. I had to push through just to get to a grocery store or wherever. And it just shouldn't be that way. Our trauma was fresh, and we needed help, and the press couldn't. The press is very useful, and I have the utmost respect for the press, but they could not provide mental health therapy, and they should not be expected to. And even finding out about the support group that Mel was referencing, I still couldn't get there because I was afraid to get a loan in a cab with a man and take the cab ride. And the city said there's no funding, there's nothing in place to get you to the support group that's out at Spalding Rehab. And I'm sorry. And I was sorry too. We were all sorry. But now I'm hoping that this act will close that loophole and have a way for survivors who are still traumatized to get to the actual resource, even if they can find out it's available. But even better, I hope that there is some way that the city can put out some kind of announcements through the news, the newspapers, the internet, to give survivors a path to access those resources, because we had never met each other. We had nobody to ask. We didn't know other survivors yet. I mean, now it seems in hindsight, everybody's going, well, couldn't you pick up a phone? Hey, well, call who? I mean, you have a new brain injury and you're so messed up, you're not thinking, call Congresswoman Pressley. Not at that point. You're just freaked out and afraid to leave your apartment. So I hope that this provides a path where there is something in place that's standardized to help people access in a timely fashion.
Thank you. I do want to just make sure we're being balanced, so if we can just hear from, just because we're going to run out of time, and I do want to, they're giving me a sign here. So I would like to hear also, since you all have referenced this support group that was both providers and survivors, would love to hear from, providers as well about what you have seen up close and personal in terms of people's ability to access, how we can better support providers as well, what difference you believe this will make. While you're meditating on that, I do want to hear from Samantha, because I want to hear about natural disasters and what you have seen and what the impact of that has been and how you believe this will be helpful.
Thank you, and I appreciate hearing everyone's stories and ability to be very vulnerable. So taking a climate justice perspective on things, I think a lot of the research and testimonies provide a lot of true evidence that there are major, mental health effects from these events. Coming from a case study after Hurricane Katrina, on average, like 50% of survivors dealt with anxiety and mood disorders, and adults and children were dealing with depression, and a lot of the things about climate change is we can't always predict when these things are happening, though we do have a little more information in comparison to like the Boston Marathon, where there's no way to predict that from happening. So definitely just utilizing what we know, all of the research and science and information about climate change and how we can prepare and respond for this. Crew has held a climate preparedness week in September, and a lot of our hubs have held events about focusing on mental health in regards to a changing climate and the relevance. We also, in regards to the hub program that we're working on, it's helping people prepare and respond to these extreme weather events that are extremely scary, and like if there's any way possible to get people like prepared and have that information so to prevent these traumatic situations, though there is so little we can control about that. We're working on taking those measures and getting the information out there to people.
Samantha, just could you one more time offer those sobering statistics around anxiety and depression in the wake of Hurricane Katrina and other extreme weather events? Could you just say those statistics again around what are the numbers
Yes.
suffering from anxiety, depression?
Okay, so 49% of people of survivors experienced anxiety and mood disorders. 1 in 6 people developed PTSD after the event, and 45% of children and 54% of adults developed depression.
And none of them were any of them able to access mental or behavioral health services? Sort of what will be the impact of this act? What difference will it make?
Oh my gosh, this bill would definitely carry a lot of weight and make mental health services more accessible, especially if there are going to be more extreme natural disasters in the future, and getting these it sounds like getting these things available to people as soon as possible seems so relevant. I think a lot of the statistics are saying that we need to listen and make sure that we're addressing all of these people in an equitable fashion.
Thank you, Samantha. Dr. Shaw, is there anything you wanted to offer from a provider standpoint in terms of the trauma that you see every day, either from providers and survivors, and how we can better support?
So Harvard Street is fortunate that we have a relationship with the Neighborhood Trauma Team Network in Boston. I don't know how familiar some of our folks here might be with that, but in the Grove Hall area, we're represented by a group of community partners who are our boots on the ground folks. And when any kind of crisis happens, they show up and they work the relationships. So they talk to, if the school bus went by, they go over to the school, they see how the kids are doing. If it was outside, if something happened and it was outside the business, they walk into the business and they see how people are doing in there. Do people need any kinds of supports, including, we're second tier in this relationship. So we are the the folks who take the phone call when they say, we have someone who's been adversely affected by trauma and they need behavioral help. And that's when we step in. And I remember going to the first meeting that we were called to when we had joined the network. And I said to one of our community partner folks, I said, why doesn't anybody know about you? And he kind of shrugged down. He said, well, we're too busy doing the work. I mean, I really think that what is paradoxically fortunate here is that in the wake of daily, routine, traumatic events, you have these marvelous individuals who did not wait for someone to come and fix it or figure out how it's supposed to be done. They just started doing the work with the people. They started developing the relationships. When they needed something more professional, they came to someplace like Harvard Street. But those, the things that do need to be done in order to make those connections so that they are established enough so people know that they're there and they can go to them, because I fully agree, the ability to get any kind of behavioral health, and this is across the country, this isn't just in Massachusetts, where frankly we're kind of fortunate because even though we can't find providers for everybody, because we cannot find enough people to cover all the people who desperately, more than 100% need a range of supports for as long as they are necessary with the kinds of competencies that meet the precise need as it arises. It's not there.
Dr. Shaw, can you, and then we have to
Sure.
transition in a moment. I'm going to give Representative Worrell an opportunity to say something, and then we'll hear from Melinda. And then we have to transition, and we got to do all this probably in about 6 minutes, okay? But no, Dr. Shaw, no, what you're saying is so important, and I was wondering if you could just quantify, like, you know, what's the average wait list, or, you know, things like that. So, because I don't know that people really appreciate when we say that you can't meet the need, you know, what we're really talking about.
My wait list right now for testing is about 30 people deep, which isn't terrible, but it could be months. My wait list for therapy is longer, so it could be 75 people, and it's variable because if I don't have enough availability of a Spanish-speaking provider and I have someone who only speaks Spanish, they are waiting longer. If it's some kind of special, if it's someone who wants someone to work with their children or something, say ADHD or autism, something that's more specialized, I need to wait till I have the right person.
Got it.
And we do refer people to Project Interface, which is out of William James College. I don't know if people are familiar with that. I just try to spread the word for that in as much as I can when people are trying to find providers and calling their insurance companies. And I don't like relying on insurance companies, but they are also, you know, they've got people sitting there phone banking trying to find providers for people. Like they're trying to make those connections. So we don't have a robust system where you can connect the right provider to do the right work with the person in the moment that it's needed.
Thank you, Dr. Shaw. And honestly, this is a question I've been asking myself a lot, which is, how do we heal the healer? Because as we continue to hear, you know, devastating numbers of an increase in doctor suicide and depression amongst providers, burnout, you know, people leaving, you know, a calling that they've answered and dedicated their whole lives to, especially on the heels of COVID and just the many layered traumas that we're navigating, we are going to have a conversation about how we support providers, how we heal the healers, you know, at every level. Martin, before we transition to Representative Worrell, is there anything that you wanted to offer as we're closing out?
No, as you were saying that, I remember the support group that I did at Spalding, and it was extremely eye-opening. You know, doing a support group, so it's not just talking, you're sitting down for 3 hours at a time, weeks at a time, and listening to survivors, but also the healthcare providers, and it is extremely important. So I'll leave it at that. It is incredibly important work you're doing, and I deeply appreciate all your work.
Thank you, Martin. Okay, Representative Worrell, and then Melinda has something that she wants to offer before we transition.
Good afternoon, everyone. Christopher Worrell, State Representative of the 5th Suffolk District. So excited to be here. This morning, I had an interview talking to about 57 young activists, and they asked me, how do you get your policies across? And I always quote, what Ayanna Pressley says, is the ones closest to the pain is the ones that should have the power to write the policy. And this is what we're seeing right here today. We're seeing how government works. A constituent coming to the congresswoman and making it into law, and our president signing it and making it law. And this is truly effective, and I thank you for the advocacy you've been doing statewide. And also, trauma's real in our communities. Around Thanksgiving, my son's barber got shot and killed. And we were getting ready to go to school, and he seen his face flash on the news. And he turned to me and said, "Dad, what happened to Max?" And what do you tell an 8-year-old boy who all he knows is going to the barber, having laughs, having conversation with his barber, Max? What do you tell him? So thank you for this bill. It not only does it mean a lot to every survivor, but it means a lot to me and my family. Thank you, Congressman.
Thank you, Representative. Melinda.
Thank you, Congressman. I'm in regards to the Post-Disaster Mental Health Response Act. One item that impacted me directly, well, two items. One is while I was working, and they knew on the job, everybody knew on the job what had happened because we were in the news. Unfortunately, I chose to part ways because the executive body of the organization was not understanding what I had gone through. I will tell you, I was absent while on the job. I was unable to focus. I was afraid to deal with the patients or people who would come in who required speaking to me because I was feeling not just insecure, but exposed. And I chose to leave. However, if I had had the opportunity, and I did ask the human resources people at the very end, why couldn't I go on a sabbatical or some sort of way to get better and come back? And I was told, since you've already put in the paperwork for leaving, that's not possible. Now, in my opinion, an act such as this should also think about how people are dealing with their livelihood and jobs. I mean, I was not eligible for unemployment. Eventually, people from the Resiliency Center told me to apply for disability. And that really helped a lot to be able to have some money coming in. So that's one aspect of it in terms of thinking about if this act, because this was only 7 months after the bombing, so in terms of time, it would have fallen under that, thinking about jobs. The other part of me was very much impacted by COVID. At the same time that my husband was away when COVID started, and honestly, I've had to take it. I've had to do it alone. He's gone back and forth to Costa Rica several times because we lost family members to COVID. We lost 3. Not even thinking about how many people who I was very close to who were taken from us, from me, due to COVID. And at the same time, when I don't know why it happened, it's in God's hands, there was a shooting on my street. And of course, I follow all the shootings in the community. That was part of my job. So it's like secondhand. But I reached out to Julia because that was the summer of firecrackers. For those of you who live in the city, you know what I'm talking about. And they're not just little firecrackers, they're the little swirlers. I'm not talking about that. I'm talking about these things like M50s or whatever they're called. And those were the sort of things that were inside the bombs. So they sound like the bombs. And they were happening everywhere. I swear I could hear them down on my street. Okay? And I couldn't sleep for a good 2 months. I had to have my windows taped shut and put like extra soundproof stuff on it. It was terrible. And we went back and forth, and we tried to do things within the city, the people who were impacted, along with the city. I'm glad it's passed, but I always worry about it happening again. As it is the 4th of July, and I do not like each other, or any other times with fireworks. Yeah, it was terrible. And I did not know after the bombing that if I went on the 4th of July to the Esplanade, which was during the day, you didn't expect any firecrackers during the day, right? The cannons would be going off. Okay?
Thank
So,
you, Melinda.
thank you.
Thank you. All right, well, again, I thank you all for joining us today. I thank my colleagues in government. I consider you all doing the work of healing and restoration every day as lawmakers and as my partners in this work. Again, we thank Harvard Street for being our host. We thank you for the work that you do every day. We thank you for standing in the gap. We thank Manya for your fortitude and your advocacy and your vigilance. You are one person, but you represent thousands. And I know your survivor community is feeling a little bit more hopeful and encouraged today because of your advocacy. And with that, I think we're going to transition to the press portion. All right. So just give us a moment to do a little bit of reconfiguring, or are we going to stay here? Okay. Okay. All right, so if folks need to get on with their day and their lives, this would be the moment to exit. If you would like to stay and join me in community as I answer questions from the press, you're certainly welcome to do that, as they might have questions for you as well. Okay.
If you could just, for people who aren't here, explain specifically what your new legislation does and how it would potentially change things for people impacted by the marathon bombings.
Sure. Well, actually, I'll let Manya do it as a survivor. Manya, do you want to offer some? Okay, I'll start it off. Okay.
Start it off.
Okay. All right. Great. All right. So this is a bill that we introduced in 2021. It expands mental health supports for survivors of natural disasters and terrorist attacks that are designated emergency declarations by FEMA, like the Boston Marathon bombing. So specifically what this will do is it's going to expand eligibility for FEMA's Crisis Counseling Assistance and Training Program, CCP, which provides short-term mental health resources for survivors. So here's the technical fix that our legislation, the Post-Disaster Mental Health Response Act, gets at, is that there's a distinction between major disaster declarations but not emergency declarations. So with this technical fix, now in instances of major disaster declarations, survivors will be able to access behavioral and mental health supports. It's a little wonky, so the most important thing is this is a technical fix that is going to save lives. That's really it. Because there are people suffering in silence with invisible wounds, with physical wounds, with primary trauma, with secondary trauma, in the wake of a natural disaster, extreme weather event, or domestic terrorism, and they cannot get psychological first aid. So with this technical fix that distinguishes between a major declaration, a disaster declaration, and an emergency declaration, now for major disaster declarations, people will be able to get help.
So will it be easier for them to access? Can you explain that a little bit? Like, how does that work?
Okay, it's wonky, so I'm trying, I don't want to lose your audience. So I don't want to lose your audience by getting too technical here. Okay, I will get wonky. All right. So under the Stafford Act, state and local governments can ask the president to declare either an emergency declaration or a major disaster declaration, which would unlock financial and programmatic support from the federal government through FEMA. So major disaster declarations like COVID-19, September 11th, are typically more expensive. So they do not have a price cap. And they provide a larger menu of supportive programs for state and local governments to choose from. So one such program is the CCP, the Crisis Counseling Assistance and Training Program. So the Boston Marathon bombing received an emergency declaration because it required a lesser amount of federal assistance for its recovery. So therefore, if Boston did not have the ability to request support through CCP. Wonky, technical, but that's the response. So, okay.
I guess the last thing I would ask is, everyone knows there's a shortage of mental health professionals out there, and there is a great need. Do you think there's anything more Congress can do to help change that?
I'm hesitating only because this is so much bigger than identifying pipelines and informing aspiration and training people. All of those things need to happen. But it's also that we have to create a climate and an environment where providers are taken care of and they can thrive. So as an example, student loan debt cancellation. We need to see that happen because so many providers who took on debt to do this work have gone to the communities with the greatest need, which often means they are getting the lowest pay, and they can't pay off these loans. And so it's one way to incentivize those who, there's an adage that says your job is what you get paid to do, your work is what you get called to do. They've been called to do this work, but it is not financially viable. I mean, we know the cost of living here is expensive. We're now the third highest cost of living in the country. So that's one way we can incentivize. I mean, again, it's about supporting them in their lives, not just about the bench and the pipeline and the training and the cultural competency and all of those things which need to happen as well. So it's in terms of Congress, that's one thing that I would offer. But I am hearing about this deficit and this shortage everywhere, again, because people either are burnt out and leaving, people are retiring, or again, people are in their own psychological distress, and we do see an increase in suicide.
I'd like to say something. I certainly can't address what Congress can do, but the Post-Disaster Mental Health Response Act means that we are going to be helping people after emergencies, right? We're going to be helping more people. And we know that the earlier you can help people, the better chance they have of recovery. And that might mean helping people enough that they don't then need formal mental health treatment. So it's both taking care of the pipeline and making sure we have enough mental health.
Addressing the volume.
But it's also addressing the volume. By helping people earlier on, we might be able to support people without needing to get into that pipeline.
And we can continue to invest robust federal resources in our community health centers, okay, who meet the needs of the most vulnerable, and continue to make those, what I continue to fight for is those investments, socio-emotional wellness supports in our schools as well, and stop asking our teachers to be mental health clinicians and just make the investment in them. Dr. Shaw, is there anything else you'd like to add in terms of? Okay.
This probably doesn't address that, but some things that Congress can pay attention to is how mental health providers are compensated. One of the things that makes it a little harder, one of the things that makes it a little harder for good places like Harvard Street to hire, oh, okay, the tremendous folks, sorry, that work here is that we have to be able to compensate people for the very hard work that they're doing. And we can't do that if Congress won't help us out and make sure that Medicare rates match what they should be so that I'm not trying to compete with private practice.
Perfect.
Yeah, period. I mean, and another thing you could do for us is just make sure our people have housing. Because it's really hard to work with folks. They spend longer in treatment because social determinants issues that get in their way, housing security, food insecurity, fuel assistance, the full gamut of things that we worry about for our people, they can't be tending to their trauma. They can't be dealing with their relationships if they are worrying that they're not going to have a roof over their heads. And let me tell you, that's the thing that people were coming to me and asking me about. Like, behavioral health is great. What are you going to do about social determinants? I'm like, we can only ask for so much, but if people are willing to ask, that's what we're asking for.
Thank you. Yes. Yes.
How many emergency disaster declarations are there a year in the U.S.? As a way of asking, how is this going to help close that loophole for people who are facing this lower level in that how FEMA determines different types of disasters?
I'm sorry, I don't actually know that. I don't know the number, only just that they're growing. I mean, like everything else. And so we just want to make sure that wherever there is an event, that survivors are able to get on a pathway to the restoration and the healing that they deserve, whether their wounds are physical and psychological or purely psychological. You know, I'm just of the belief that our greatest wealth as a commonwealth and a country is the health of our people. And the health of our people has been compromised and undermined in every way, whether you're talking about the pandemic. Tomorrow I'll be doing a discussion about my legislation to support the COVID long hauler community, which is sadly a growing constituency. When we talk about housing, that is a social determinant of health, dictates, you know, health, social and economic mobility. Whether we're talking about early education and care and the fight for universal pre-K, which determines the trajectory of people. So all of these things are interconnected. No one lives in a big check box. People live in complexity and nuance and intersectionality. That's the way I seek to legislate. That's the way my partners seek to legislate. So all these things are connected. The point is that the burdens are heavy. The trauma is layered. And this is just one way that I'm trying to get at these particular traumas, which are growing. Okay, well, because I have an incredible team, they've gotten us some data. Do you want to ask the question again? So I can give you a clean frame here? Okay, it's 4,000 emergency declarations in the last decade.
Great, thank you.
All right. Thank you, 18. And they made it really big font because I'm 49 now, the vision. You could probably read my speech from over there at this point. Okay, any other questions? Oh, yes. Councilor Mejia, comment?
Yeah. I'm learning how to show up. I'm not sure if I can ask a question, but I wanted to share a comment that I always say this everywhere that I go, is that Boston in particular, we are resource rich, but coordination poor, right? So when we have a lot of access to opportunities, what we don't have is the infrastructure to get people connected to what they need when they need it as soon as possible, right? So I think that there is an opportunity for us to really lean into that a little bit in terms of how we can build stronger infrastructure. And then the last thing that I want to say is that, you know, one of the reasons why I'm so super excited that we have a Congress representation in the Massachusetts 7 is that we're changing the conversation. And you've only been in office for a few years, and in the few years that you've been in, you have changed the conversation, right? And I think that what we're trying to do here And what we, God, you better take this. Is that what we're trying to do here is that some of these things can't legislate, right? There's certain things we have to recognize that we are trying to change the hearts and minds of people. And sometimes people are not ready for doing what is right. And so there's certain things that we can push through the legislative process, but then we also have to manage our expectations, is that there is an attack on Trump. And people would rather us just suck it up and keep on moving than pause and deal with it. And that culture is something that I think is going to be really difficult for us to legislate, but I think that through these initiatives, we can shift the conversation. And I just want you to know that you are doing, it's a big lift. And we have to manage our expectations because you are battling people who are not ready for it.
Thank you, Councilor Mejia. President Murphy, do you want the final word? Thank you, Councilor Mejia, and I reiterate what I stated earlier, and I've had these conversations with the White House directly. Although trauma was real pre-pandemic, I do believe that trauma is the second pandemic. And so I continue to advocate for the White House, in fact, to have a White House summit on trauma. I think it rises to that level of prioritization on community-based responses to trauma. We cannot do the work of recovery focused only on the economy. Of course, we don't want to leave any worker, any family, any community behind, and the work of the pandemic recovery must be just and equitable. But we have to emotionally heal and recover too, and that is just as real. So again, we thank everyone here at Harvard Street, thank all of our survivors, our state panelists, my colleagues in government, and most of all, we thank all of you for making sure the story gets told. Thanks. Have a good day.
The best line, I would suggest, and I think you should do it again. Right around to the first one.
Okay.
Seriously, that resonates.
Okay. Thank you. Thank you.
Great job, Sophia.
You know,
Great job.
it's hard, as a former elected, I'm just like,
But I'm telling you,
it's
I'm
very
telling you.
precise language, so I don't know.
But that resonates.
Okay.
I'm telling you.
All
That's what
right.
I like.
Okay.
That kind of explains.
Okay.
Yeah, I sometimes looked at it, was there.
I love it. Nice to meet you in person. Injured hamstring.
Oh, we can, they are. Yeah. I was coming up.
Was,
Married to it.
yeah, I just want to get a quick photo with.
It's like, you look so
I was like, that's one of mine.
Jessica, do you want some?